It comes as businesses are requesting exemptions to open thetheir doors again. The state's public health emergency was extended until May 4th. Now officials are looking at ways for some businesses to open up with new guidelines for social distancing, hygiene, and public health. Let's go live to Governor Walz for his phone briefing.
Thank you, Teddy. Good afternoon, everyone. Good afternoon, Minnesota. Privileged to be with you again. I know these stressful times, times of anxiety and the personal tragedies. It's, I think, good to continue to highlight things that are very Minnesotan and things that are going the way they're supposed to. And this morning, I got an opportunity to participate in one of those. As many of you out there listening know, that we've struggled to make insulin affordable to folks who, no fault of their own, need insulin to survive, and we fought a battle with special interests and fought a battle sometimes against ourselves in our politics. But today's a day to rejoice. That is now a law of the land, and one of the first states to tackle this issue. So this morning I signed the Alex Smith Insulin Affordability Act. I was on a WebEx, so I was digitally surrounded by advocates who have now become friends, who've worked tirelessly on this legislation, and legislators on both sides of the aisle, in the House and in the Senate, who have picked this up and worked on it, who have struggled to find compromise and continued to work through it. And many of you may know, or if you do not, Alex Smith was a bright, ambitious young man, 26-year-old, out on his own, proud. He was unable to afford his $1,300 a month insulin, and so he died rationing it. And this happens, I've heard this story time and time again, because he left his parents' insurance at age 26. And his mom, Nicole Smith Holt, turned her personal tragedy, a heartbreak that as a parent I can't even imagine, and turned that into public advocacy to make sure that no other family had to go through that. And she made the case that no Minnesotan should have to choose between food, rent, and a drug that they need to survive. She fought this thing for the better part of a year and a half. And I'm just proud today that the legislators, the advocates, and the administration, we came together on a short and long-term solutions to the insulin crisis. It wasn't always a given that it would get done, but it certainly was for the advocates like Nicole and so many others. So this is a model, too, on how we can get things done. I've said that in the only divided legislature in the nation, the ability to work together is absolutely critical. If we retreat to our ideological corners, we can't get things done. This thing took us way too long. We eventually did do the right things. I would encourage all of us to continue to voice our differences in a constructive manner, to voice our differences by putting out solutions to problems that Minnesotans care about. And if we do that, we can get things done. If we do that in this time of crisis, like we've continued to, we can pull together and make the case that Minnesota is stronger together. And I would turn some people's attention, if you haven't seen it yet. Our Minnesota sports teams, our professional and our university teams, put together a video. While it will make you tear up, it'll make you look forward to when sports come back into our lives. It'll also show you what's really important about this state and about how we get things done. A couple other notes. I want to remind Minnesotans, MNsure special enrollment period is open. That's our state's marketplace. You can go there to get answers to your questions about insurance or choose a plan. In March, we announced a 30-day special enrollment period for COVID-19. Since that time, over 3,600 of your uninsured neighbors have been able to access private health insurance through MNsure. Over 10,000 more have applied for the public programs through that special site. But the deadline to enroll is Tuesday, April 21st. So please go online to MNsure.org to get covered. If you need help, MNsure has a statewide network of sisters, navigators, who can help you get through that process, and that doesn't cost anything. On another front, the DEED, Department of Employment and Economic Development, continues to lead the nation in implementing CARES Act as fast as possible. I'm proud to say that Minnesota is one of the first states to implement the additional 13 weeks extension to unemployment insurance. that hits folks who are already maybe using up their benefits. Commissioner Grove will have a few more details on that and can talk through it on what that's able to do. But I want to thank them for the quick work they're doing. And again, continue to those of you out there listening, I get it very clearly. If we get it right 99 times out of 100, it doesn't do that one person much good. And I can tell you, though, that we are continuing to improve our processes, continuing to work basically round the clock and add more people to be able to do that for you. Also, a little different this year. It's April 15th. It's tax day, but in keeping with the federal extension, Minnesota is providing additional time until July 15th for taxpayers to file and pay their income tax without penalty or interest. Make sure, again, I ask all of you, if you have a refund, file, and I hope you've already filed, file early. The stimulus checks were based on either your 2018 or if you filed a 2019 tax return. So we want to make sure that we continue to track on that together. As Minnesota responds to COVID-19, we're providing grace periods where we need it. So please let us know. Please, the Department of Revenue, while they're working round the clock too, they're there to try and help. They've got committed individuals working with businesses too, making sure that you're not penalized for this and more negatively affected. So that's good. And then before I turn it over to Commissioner Malcolm, the next news I'm going to share is exactly where Minnesota needs to be. When I talked to you a little over a week and a half ago on the state of the state, I mentioned that Minnesotans aren't just going to get through this, that we're going to lead. And that has proven true this morning. The University of Minnesota has received FDA approval for the design of a new low-cost ventilator aimed at helping clinicians in settings where you can't usually get a ventilator. It's called the Ventilator. It's the first of its kind to be authorized for use under FDA's Emergency COVID Authority. It was funded by the U's Rapid Response Grant that spurs innovation around treating the virus. A medical school resident and a College of Science Engineering colleague put together a team to build the prototype to be readily available, and they used the things they had in their lab back in March. They've now refined it to be desktop size. The Ventilator is relatively inexpensive to manufacture. Its specifications will be put out on an open source online, allowing other manufacturers to begin their own regulatory and production process worldwide. So thank you, University of Minnesota. Thank you, Minnesotans, for funding one of the great, if not the greatest, land-grant university in the country, an innovator for so many years, an innovator, as I've often talked about with Norman Borlaug and the Green Revolution, an innovator in medical technologies, and again today, another addition to the global fight against COVID-19. So thank you for that. I spent some time this morning speaking with all the other governors, specialty hospitals, and after this call I'll be speaking with Secretary of Defense Esper about the progress that Minnesota has made in our preparations. And to give an update of where we stand today, Commissioner Malcolm, please go ahead.
Thank you, Governor. Good afternoon, everyone. I will again start the briefing with just the global and national statistics. Worldwide, as of this morning, we had just over 2 million cases and over 127,000 deaths. In the United States, we are now reporting a total of 609,685 confirmed cases and just over 26,000 deaths in our country. Here in Minnesota, we have yesterday confirmed an additional 114 cases via laboratory confirmation, so we're now at a total of 1,809 cases. Unfortunately, we again today are announcing 8 additional deaths among our neighbors. So we now have a total of 87 total deaths in Minnesota from COVID-19. The 8 deaths from yesterday were, again, heavily concentrated in the elderly. All 8 were long-term care residents, 6 from Hennepin County, 2 persons in their 90s, 1 in their 80s, 3 in their 70s, and 1 each from Clay and St. Louis counties, 1 person in their 70s and 1 in their 90s, respectively. As of today, there are 197 patients currently in the hospital, 93 of those in intensive care. So as you can see if you're tracking the numbers, both the total case counts and the hospitalizations do continue to increase, but on about the same pace that we've been seeing in recent days. And as of today, 940 patients have been released from isolation. I'd like to just close today my part of the briefing by commenting on the importance of infection control and the hard work that's going on in our long-term care facilities. As we've been talking about, we have a particular concern about long-term care facilities because the residents and the workers in those long-term care facilities generally face a population of higher-risk people living in close quarters in a congregate setting, making it a particularly ripe environment for the spread of COVID-19 and other infectious diseases. That's why we've been working so very hard with those care providers to make sure that the facilities are implementing very strong infection control practices. And while by no means am I saying that we are out of the woods or have everything totally under control, we absolutely need to keep our vigilance, keep our guard up. We're stepping up every day, closer and closer collaboration with hospitals and long-term care facilities and across various parts of state government to make sure we're marshaling all of the support we can bring to these facilities. We are seeing some early indications that this infection control emphasis is having a positive impact. So when you look at the data again, we see 108 facilities in which COVID-19 cases have been confirmed. And as we have said many a time, we know that the total number of lab confirmations just represents a part of the underlying story. But of these 108 facilities with confirmed cases, fully half of them have only one case as of today, which really does suggest to us that infection control is helping limit the spread of those infections. We've still got a long way to go, a lot more work to do to make sure we're supporting these workers and these residents. But I think it's important to take a moment to acknowledge the hard work of those facilities, staff and administrators, and to thank them for all the work they're doing to help protect our loved ones in long-term care settings. And I also want to thank the MDH and local public health staff who've been working tirelessly to support them in this work. Thank you, and with that, I will pass it off to Director Kelly.
Thank you, Commissioner, and hello again, Minnesota. I'm going to spend my time today talking about a couple important Severe Weather Awareness Week topics, floods and tornadoes. I know our collective attention is focused squarely on fighting the virus, but as I've said before, we live in Minnesota, where the weather always has a vote, and we need to be ready for it, regardless of what else is happening. Today's focus is on flooding. Minnesota, as we all know, and we're proud of the fact that we're the land of 10,000 lakes, and that's one of the things we love most about this place. But from time to time, our water turns on us. And Minnesota is indeed one of the most flood-prone states in the country, but that's not news to anybody who has lived here for very long. And our fellow Minnesotans up in the Red River Valley are just coming out of their latest flood. It is our number one natural disaster threat by far. I looked at records for the last 10 years, and Minnesota has experienced 28 major flood and flash flood events that have triggered a state or federal disaster declaration. Flooding is also the most common, widespread, and expensive natural hazard across our country and around the world, especially if you factor in the storm surge flooding associated with hurricanes. There's two key flood messages I want you to think about. The first is turn around, don't drown. Never, ever drive through floodwaters. You really don't know how deep the water is, what the bottom surface is like, nor how strong any current might be. Do not drive around road closure barriers. They are in place for your safety. So please, turn around, don't drown. The second key message is to consider buying flood insurance through the National Flood Insurance Program. The standard homeowner or renter insurance policy will not cover you for flooding. Additionally, make sure your homeowner's policy has an additional rider for sewer backup. It's often not covered automatically. Sometimes it is, sometimes it's not. So as always, consult with your insurance professional and understand that FEMA disaster relief is no substitute for flood insurance. Tomorrow is our annual tornado drill day. Because of workforce restrictions, we coordinated with the National Weather Service and Wisconsin Emergency Management on a slimmed-down drill. So at 1:45 in the afternoon tomorrow, most counties in Minnesota and Wisconsin will activate their outdoor warning sirens and other notification systems. Keep in mind, the choice to activate sirens is a local decision made by counties and cities. The National Weather Service will also be posting some information on social media at that time, but they will not activate NOAA weather radio. At 6:45 tomorrow evening, many counties in Minnesota will again activate warning sirens and other notification systems. And same as in the afternoon, the Weather Service will not activate NOAA weather radio. In Minnesota, we do 2 tornado drills. One in the afternoon when most of us would normally be at work or school, and again in the evening when most of us would be at home. And we do that because we take different actions depending on where we are. But the drill is the same. Take cover and get information. When you hear outdoor warning sirens, go to a designated safe shelter at school, work, or home, and gather information from your favorite source, radio, TV, online, or social media. And in the days of COVID-19, please social distance as well as you can in your storm shelter. These annual drills are fundamental to being prepared for the severe summer season of weather that lies ahead for us. So please stay safe and, of course, stay healthy. I'll turn things over to Commissioner Steve Grove with the Department of Employment and Economic Development now. Commissioner?
Well, thanks, Director Kelly. Good afternoon, everybody. As the Governor mentioned a moment ago, we do have some good news to begin our update today, which is that 13-week extension that came through the CARES Act for unemployment insurance has now been fully implemented into Minnesota's unemployment insurance system. What that means is if you are near or at the end of your unemployment insurance benefits at this point, all you have to do is log into your account and indicate that you're still unemployed, and you will be eligible for an additional 13 weeks of unemployment insurance. This applies to everyone in the state who is unemployed and is using the system, and you don't have to do anything extra other than just log into your account and let us know that you remain unemployed, which is something everyone has to do every week regardless. We think that we're one of the first states to implement this provision, and there are about 8,000 people by our count who have exhausted or will soon exhaust their regular unemployment benefits. So not a moment too soon for those 8,000 Minnesotans to get that benefit up and running. We've now gotten 2 of the 3 major provisions that came through the CARES Act for unemployment insurance at $600 top-off payment that we announced last week. We were the first in the country to get that up and running, and then this additional provision for the 13-week extension. So we're continuing to work night and day to make sure that we get our system updated with these new benefits for Minnesotans. The last and probably the most asked about provision is, of course, this unemployment insurance for the self-employed and for contract workers. We'll have that up and running by the end of April. No state in the nation has got it up yet. It's complex, it's important, and we are making sure to build this really entirely new system for ensuring we can get those benefits out and prevent fraud night and day right now until it'll be up and ready. So more soon then, but we wanted to continue to let people know we're working on that. And we do encourage all those who are self-employed or contract workers to apply for unemployment insurance now. Even though you will currently not be eligible, getting your account up and ready and getting you into the system will only speed up our ability to pay you once we're finished with the build. And we'd encourage you to apply and not be discouraged by the fact that you're not eligible yet. We will proactively reach out to you as soon as those benefits are available. Today's unemployment numbers, we are at 464,513 total unemployment applications since March 16th. That's up about 13,000 from yesterday. Our top occupational groups represented are food preparation and serving, sales and service, healthcare, including both practitioners and support, office and admin support, and production. I wanted to turn to small business supports. As you all know, the Small Business Administration has launched several programs at a national level to help small businesses get through this time. And one of the most popular is the Paycheck Protection program, which gives loans to businesses who need the money to continue to meet payroll. And if they keep people on their payroll and use those funds to make those payments, most of that money is actually forgivable. About 70% of that money has been called for nationwide. I'm happy to report that Minnesota has the 3rd highest loan dollars per capita of any state in the country for that program. So we've moved very quickly as a state to get lenders up and running, the SBA connected to those lenders, and ensure that we can help Minnesota businesses take advantage of this program. We've done, and by we I mean the SBA. This isn't BEAD. This is our partners in the federal government. Have done 33,819 loans. They've approved $7.6 billion worth of loans. The average loan size is 225,713. And the per capita number, which, again, as I said, ranks us third in the nation, is about $1,350 per person in the state, if you just look at where we rank in terms of taking advantage of that funding. So we're very grateful to our partners at the SBA. Brian McDonnell and his team have done a great job of making sure that money is available to Minnesotans. There's some challenges with all these programs because they're large and complex, but getting Minnesota at the top of the pack of states that have taken advantage of that money is, of course, really important. And then lastly, just wanted to continue to celebrate Minnesota businesses who are doing great work in our state. Today I wanted to talk about Wintergreen, which is an iconic outdoor performance clothing manufacturer in Ely, and they have shifted to making protective medical gear, including face masks and medical gowns and headgear, particularly for Iron Range and North Shore clinics. They've done this for some time now. Owner Sue Shirkey has really been at the helm of this, using home sewers across the community in addition to the workers at her business to produce face masks for community members. And they're even using local sewing shops and quilting shops to come together to make these masks. So great to see businesses not only using their employees but also their communities to come together and provide for healthcare clinics at this time of need. With that, I'll turn it back over to Governor Walz.
Thank you, Commissioner. Before we take questions, I would just say, Minnesotans, what we're doing is working. And when I say we, I mean all of us. Our social distancing has bent the curve. We are still maintaining that lowest infection rate in the country. We are responding internally in government, as you just heard the commissioners talk about, some of the best, if not the best in the country, of providing that safety net, from unemployment insurance to the loans to working together. Our public-private partnerships are starting to bear fruit in producing PPE, in testing, and in innovation. And this is all key, that this sets us up to bridge to that next place. If we can continue to maintain what we're doing, if we can continue to do the things that have been asked, we are as well positioned, as I continue to say, to lead and to show people and work with our neighboring states to show how we can bridge to start bringing back some of the things that we know we want to bring back. And that's, of course, getting people back to work, but with an understanding that the social distancing and the work that we've done, we cannot lose all that we've gained. We have put this state in a position where we're saving lives, and we can do it as well as anybody, and we've proven that. So I want to thank you for that, and at this time open it up to questions.
As a reminder,
you've been watching today's media briefing from Minnesota Governor Tim Walz. You heard the shout out there at the end to Wintergreen up in Ely, a story we reported on last week that they've switched to making headgear and gowns specifically for Iron Range and North Shore clinics, as well as the update that the 13-week extension to unemployment insurance has been fully implemented now in Minnesota for those of you who need it. We'll continue to track developments this afternoon and bring you updates as they happen on the WDIO website and mobile app, and we'll have the latest on WDIO News at 5. Have a good afternoon.
This has been a WDIO News special report.